I'm Dr. Angie Stoehr, and this is Feminine Curiosities. I've received a decent amount of questions about the Going Rogue video, so I'm going to address some of those on Going Rogue to the back door. So, a couple of the questions I've gotten. Number one, is it possible to permanently damage the rectum in the process of having anal intercourse? The answer to that is probably not. So, the rectum is a pretty interesting muscle. It has several different layers in it. There's an internal and an external sphincter. The internal sphincter feels pressure when there's stool sitting in the rectal verge. And that's what signals you to say, hey, I gotta go to the bathroom. So, in the process of the internal rectal sphincter cinching up, that gives you a signal. So, you go sit down on the toilet. And in the process of sitting down on the toilet, your body will naturally relax the internal sphincter. And then the external sphincter relaxes as well. So, it's kind of a subconsciously controlled muscle with conscious override. Now, I talk with some of my pelvic pain patients about something similar here, so I'm going to use the same analogy. It's kind of like your diaphragm. Your diaphragm breathes for you all day long and all night long without you having to think about it, right? Perfect. Your pelvic floor muscles kind of do the same thing, and part of the pelvic floor muscle includes the rectal sphincter complex. So, your rectal sphincter has a nice little natural tone, and that keeps you from leaking poo, for which we are very thankful, right? But when you want to, you can override that. Just like when you want to override your diaphragm to take a deep breath, you can override your rectal sphincter consciously to sit down and poo. So your rectal sphincter is meant to stretch and contract and stretch and contract to pass stool. In the same way, the rectal sphincter can relax and contract to accommodate something going in the other direction, whether that be a toy, a finger, a penis, doesn't really matter. Now, highly recommended to use a lot of lubricant in that process because your body's natural system stimulates the internal sphincter first and then the external. And when you're doing it the opposite direction, sometimes it takes a little bit of effort to consciously relax that internal sphincter when it's getting the signal from the wrong side. So that's one thing. We don't think it permanently damages the sphincter. Now, if you are regularly putting very large things up inside of there that potentially would damage the muscle tissue, i.e., a very large dong or dildo, or rectal fisting, yes, that's a thing. I don't recommend Googling that. It's possible to damage the muscle tissue stretching it too far, in which case it may not completely rebound as it's supposed to. And if you damage the muscle tissue, it is also possible to leak stool. But a regular size and even a large size human penis and normal size dongs and dildos and things that are intentionally made to go into the sphincter for sexual pleasure typically will not cause any damage. That rectal sphincter just goes right back to normal on the back end. I could not help myself. Okay, so one of the other questions that I've gotten about anal intercourse is it possible to get pregnant that way? And you would think this is an easy answer, but not exactly. Um, the problem with intercourse, yes, when you're putting a penis inside of a rectum, you won't be getting sperm into the vagina in that process. However, it is important to know, and this is good to know for vaginal intercourse as well, there is something called pre-ejaculate or pre-cum. It has a lot of sperm in it. A normal ejaculate has millions and millions of sperm in it. Pre-ejaculate has hundreds of thousands to millions of sperm in it as well. You only need one to make a baby. So, unless that penis is covered properly before any pre-ejaculate comes out, it is possible in the process of getting the penis into the right place to put it into the rectum. If some of that ejaculate with sperm in it gets on the perineum and or close to the vagina, could somebody get pregnant with that? Yes. Is it likely? No. Now, the other question I've gotten fairly frequently, which seems like it would be fairly logical to me, is condom use required during rectal intercourse? Yes. Oh my gosh, yes. Granted, you aren't going to catch gonorrhea, chlamydia, and trichomonas of the vagina when you have penetrative intercourse of the rectum. However, a lot of the other STDs can be passed with rectal intercourse, stuff like HIV, syphilis, herpes, etc. So it is important to always wear a condom on the penis owner in the process of having rectal intercourse. So I hope this has answered some of those questions. If you all have any more questions, please write them down below. Hit like, share me with all of your friends.